So for my career research paper, I decided to write about how I want to become a pediatric oncology nurse. So a pediatric oncology nurse is basically just a nurse that works with children with cancer. And the reason that I want to pursue this as a career is because, for one, I've always been really good with kids and I've always loved them. And I've always just seen myself working with kids rather than adults. And the reason I chose oncology is because cancer has been in my family before, and I just find it really interesting on how it forms and spreads through people. And also, I find it really rewarding to be able to help people and be there for families while they're going through a hard time, and to at least make some type of difference in making it more comfortable and peaceful for them. So some of the education and qualifications you need. First of all, nursing takes a very specific and high level of education. So for starters, you need a high school diploma or a GED, and you need either an associate's degree in nursing or a bachelor's degree in nursing. And this might depend on where your place of employment might be after school. That will help you decide on what degree to get. And then also, a lot of schools look for students with a high number of hours working in patient care. So for example, the University of Charlotte requires a minimum of 30 hours before you apply. And you also need a certain GPA. So some schools only accept a GPA of over 3.0, but that might differ depending on what school you apply for. And then also your grades are really important, as you can knock any C's in any pre-nursing classes. So an example of a pre-nursing class might be like anatomy and physiology. So there's a lot of pros to this job. First of all, a high salary. And this will differ depending on how experienced you are and how long you've worked. And then also, there's going to be a lot of room for personal and professional growth. So this means that you're going to learn a lot as a person from meeting patients and families, and also professionally, because you're going to be dealing with a lot of patients that might have very different situations. So you're going to have to learn from that. And then also, you're going to learn a lot of resilience, because being a nurse can teach you resilience, because you're going to have to learn how to bounce back and learn from mistakes. And then also, you're going to have a very strong team environment, because hospitals all have to have a pretty strong team environment, because you're dealing with a patient or multiple patients and you have to work successfully. So it's really important to have a strong team environment. There are some cons. So first off, you're going to be creating relationships with patients, and some of these children might not make it, so that can be pretty hard on a nurse. Then you're also going to have pretty long work hours. So for example, a work day can be a 12-hour shift or 36 hours a week. And you're also going to have pretty high stress levels. Any type of nurse is going to have high stress levels, because it's your responsibility to take care of a patient, and you're basically like in charge of them in a way. Then also, there are some hazards. So when it comes to working in oncology, nurses might be exposed to hazardous chemicals and radiation during treatment. So during chemotherapy, you might be exposed to some hazardous chemicals. And there is some specific training. So you train by either working in pediatric oncology or a hematology unit. You need to become an RN, which is a registered nurse, and a minimum of 1,800 hours working in a pediatric unit. You have to take some foundational courses in hematology and oncology. And there's also certifications that you need. So for example, one is a certified pediatric hematology oncology nurse. And then you also have to understand the psychology aspect of nursing. While cancer affects people physically, it also affects people mentally. So you have to be able to know how to deal with people physically and mentally and give them the proper treatment. And you also have to have a lot of knowledge about common diagnoses and treatment approaches, as well as supportive care principles. So some of the responsibilities when becoming a nurse, and there is a lot, so obviously you're caring for a person, and so it's your job to know what their needs might be and how to properly treat them. And you're administering treatment, so like chemotherapy, and this is where you might be exposed to hazardous chemicals. But you're also responsible for giving support to the families of your patients, as well as your patients, as well as educating them on the diagnosis. So you have to be able to explain diagnoses to the families in a way that they might understand. You're also going to be monitoring the patients as well as their vital signs and the possible side effects from treatment or medication. You're also going to be coordinating appointments and making follow-up appointments as well. And then you're going to be assisting with diagnostic tests and procedures. So the job availability and salary for this job. First off, the job availability for this is very specific, but it's also very limited. It can be really hard to find jobs in this area. It's also a very needed job, but it's really hard to find because they're very particular and only want people with certain requirements. But like I said, there's a very high salary with this job. So for a beginning nurse, the starting salary might be $62,000 or $132,000 for a more experienced nurse. So it's also really important to have good knowledge, is because, for one, you're responsible for caring for patients and giving them proper treatment, and without this knowledge, you're putting a person's life in danger as well as your career in danger. So it's really important to know what you're doing, basically. So in conclusion, from the information that I've learned, I can tell it's a very hard and demanding job. However, I think the pros of this job outweighs the cons, as the connections with the families and the patients, as well as the high salary, makes up for the high demand. And there's also a very high level of education needed for this job, and there's many certifications and specific training needed as well.